Well, thank you very much, and thank you to everyone for wanting to spend their Thursday night looking at me and allowing me to talk about one of the things that I do enjoy the most, which is breeding. So I'm just going to start off by introducing you to tonight's program. I'll do a brief introduction to breeding the mare. Then I'll come on to choosing your stallion, the practicals of how to get the mare in foal, then a little bit about the pregnancy itself, and then we go on to the foaling, the first 24 hours after foaling, and we will end off with when to call the vet and a few things to consider in case things should go wrong. So just a brief introduction to start with. Mares are seasonal cyclists, so that means that they will have several cycles over a period of time. They usually start in early spring and cycle up over the summer. Some horses do continue to cycle all year round, but majority will be over spring and summer, and they will come into heat about every 21 to 23 days. If you are going to breed your mare, we do recommend that the optimal breeding age for the mare is 4 to 14 years of age for the mare. If we go any earlier than that, the mare has a lot to deal with herself by growing, and it's a bit much on them, and it can be a bit higher risk complication pregnancy for a young mare. And the same thing goes for older mares. They can be more difficult getting in foal, and the pregnancy and the foaling itself is a bit more high risk for an older maiden mare. Another few things that you need to take into consideration is the mare itself before you get her into foal. Does she have any underlying diseases or issues? Is the reason that you're putting her in foal because she's struggling with some kind of lameness that can affect her during the pregnancy? Because they do get to quite a bit more weight, which can make any kind of lameness a bit worse. And you need to consider her temperament as well, whether or not she is going to be suitable to be a brood mare, whether or not that she will take good care of the foal and will be safe for you to handle and safe for the foal. Then there's a few different options. As always, there's natural cover for the horse, which is mainly used now in the thoroughbred industry, but also with a few other breeds. Then there's AI, which is now used a lot in the sports horse industry. And here we have chilled and frozen semen you can use. Then there's embryo transfer, where you take an embryo out of the mare and put it into a surrogate mare. And other than that, there's some advanced techniques that we have as well we can do now, where you can go in and take eggs directly from the ovaries and do fertilization in the lab. So once the mare is getting pregnant, everything, she is usually pregnant for about 340 days, which is about 11 months. So, excuse me, when she does get in foal, you will have to unfortunately wait almost a year for having a little foal like we see on the right. So when it comes to stallion choice, there's quite a few things just to keep in mind. The first thing is, what does the stallion actually offer? Is he with frozen only, or is he with chilled as well? What's the best for your mare? Some horses don't do well with frozen semen. I tend not to recommend frozen semen on older maiden mares. So have a look at what the best option is for your mare and what the stallion you want provides. The next thing you need to think about is, what are your plans for the foal? Are you breeding for yourself, or are you breeding to sell it? If you are thinking of doing commercial breeding, you have to take into consideration what's in at the moment, what's sellable, and not just what you think would look nice. As always, there's price. Semen from stallions can vary greatly in price depending on how good the stallion has been, and they do have different packages available as well. So sometimes you can get a free return the next year in case that your mare doesn't get in foal in the first season. then you need to have a look about whether or not what the availability of the semen is. Some stallions' job is absolutely just to collect semen every day, and that's their only job. But some of them do have another job, which is going to competitions or possibly showing. So it's important to contact the stallion owner and see what the program is for the stallion. Is there any times that they know it's going to be away and it's not available, for example, for chilled semen? Then the next thing is getting the semen to you. In a few cases, you might have a local stallion, which means that you can just pop over in your car and get the semen once it's been collected yourself. If it's in the UK, then it usually goes by postal service, which means that it's often not available on a Sunday and a Monday. And then again, if you're getting semen from abroad, it's usually overnight courier by plane, but Brexit has complicated things a bit. So it's just nice to have an idea of where the stallion is located, so we can take that into consideration as well when we do decide to breed the mare. So once we have the mare, we have decided on a stallion, then the next thing is getting the mare in foal. So where are we going to do this? So there's a few things that you can do. You can either do it at home and have everything done at home. You can send her to stud and ask them to do it all, or you can send her to the vets. We offer a package where we take the mare in, keep her for as many days as it need for her to get inseminated and ovulated and treated afterwards, and then she can be picked up again as soon as that's done. And in the meantime, we'll take care of her and do everything for you. If you do decide to have it done at home, there's always a few things that you need to have in mind. Do you have the facilities for it? As you can see on the picture down on the left, safety is very important, and not all mares take well to having an arm up their backside, unfortunately. So is there a place that we can do it safely, possibly over a short door? Like in the picture, is there plenty of space around the mare to have equipment? Is there electricity for the scanner? And is there running water and somewhere fairly clean for when the actual insemination is there as well? Price needs to be taken into consideration as well, as even though we do have an AI package, then if it's done at your own premises, there will be a visit fee on top of it. So how is the actual process? To determine whether or not the mare's in season, we can go in, we can scan her rectally and look at her ovaries and her uterus to determine where she is in her cycle. So that usually involves several scans over course of a week or so, depending on where we find her in her cycle. That leading up to her getting either inseminated or covered, and then afterwards checking for ovulation and any treatment of the uterus in case that's needed. And even though we do try our very best to get them pregnant in the very first go, I do always advise people to budget for at least 3 cycles, as it can be a bit more difficult sometimes, and it's always best to be prepared for the worst. And it's easier to say we have prepared for 3 cycles, and then it's just great when it goes in the first try. So we get to the part where the mare's actually pregnant. So when your mare's pregnant, you still need to take all of her best interests into consideration. So she will still need regular farrier treatment, having her teeth checked yearly, more often if she has any issues, and she needs to be up to date with her vaccines. As a minimum, I require that the mare has a fluent tetanus vaccine yearly, preferably with a booster before foaling, and this is to ensure that the foal gets the best immunity from the colostrum when it's born. Depending on the mare and where you do keep her and how many horses there are around, we do recommend to vaccinate against EHV as well, especially if there's a lot of horses around, as EHV do cause abortion in mares. So another question I get asked a lot is whether or not you can ride your mare when she's pregnant. And the short answer is yes, but of course you need to listen to her. So in In general, I like to leave them alone and concentrate on being a broodmare for about the first month, just until the pregnancy is established, because the first few weeks of the pregnancy is still quite fragile, and I don't want too much to upset them and cause them to absorb the pregnancy. Once they're about a month to 2 months in, then the pregnancy is much more stable. So from that point, you can definitely ride. I say that people can ride the horse until the third trimester, which is up to about 7.5, 8 months pregnant. At that point, we go into the last part of the pregnancy, where the mare is spending a lot of time and a lot of energy on growing the foal, and that's where we see the most changes in growing of the foal. So at that point, I do recommend that they're no longer ridden, and at that point, they're probably starting to look a bit more like our mare here on the left, and it's not really feasible to ride them anymore. Feeding is another question I often get asked about, and as with any horse, we don't want them too thin, but we don't want them too fat either. So in the first 2 trimesters, you can feed her like you would normally. There's not really much change there. Majority of horses do really well just to have ad lib, good rossage and a vitamin and mineral balancer. If your mare before getting in foal has any other needs, then of course take this into consideration, but otherwise majority of the mares will do fine just with rossage and a balancer. Once we get into the last trimester, then again she is trying to get the foal ready. So at that point we recommend that you start feeding a stud mix. So lots of feed companies make a really comprehensive stud balancer, and they're all very good, and start feeding that from the last trimester to make sure that she has the energy to support herself, to support the foal, and to start producing milk. Then we get to the main event itself, the foaling, which is what we build up to. So again, you have 2 options there. You can either send the mare to a stud or to someone professional and foal her down there. The benefits of that is, of course, that there's absolutely no panic in it for yourself, and you can leave her in very capable hands of someone else that will take care of everything and knows exactly what to do just in case that anything should go wrong. And your other option is to foal her at home. So if you do choose to foal at home, then you need to make sure that you have a stable that is large enough for the mare to lie down flat and still have plenty of space around her, both for the foaling and for when the foal is out, and obviously she'll be sharing the stable. Good bedding is very important, especially up to the foaling. It needs to be a very big, thick and clean bed. I prefer straw. You can use whatever bedding you usually have, but I think straw is cheap and it's very comfortable and it's warm for the foal, especially if you have a mare that's foaling early in the season. You also need to keep in mind that other horses may upset the mare. So it's not a problem having other horses in the barn, but just be careful that they're too close and can get in contact, because some mares are very foal proud and might injure the foal in their trying to keep the other horses away. Then there's how are you going to keep an eye out for the mare foaling. You can either sit up or have someone sit up and watch her at night once we get closer to the foaling. There's CCTV, so you can keep an eye on her at all times, and we do get different foaling alarms that will alert you to when time is close. So signs of foaling being close is that the mare's bag will fill up and she'll start to have wax, as you can see on the picture just under the foaling. Some mares will run a little bit of milk before the foaling as well, which is a sign that it's coming very close. Once we get to the foaling itself, the mare starts to be restless. She might sweat, she will wander around and show mild colic signs. And at that point, they usually progress to starting to lie down and push. When we get to this point, what will happen is you'll have a white bag appear from her backside. In that will the foal come out. You can see a little bit of the white bag here on the two pictures from foaling, and that's the first thing you'll see. Next, you should have the foal's front legs, and then the head will come out, and that will go on where you get the chest out, and then eventually the hind legs themselves. So once we have the foal out, then obviously we make sure that both mom and baby are doing well. So general rules for newborn foals is that we would like them standing within an hour of birth, drinking from the mare within 2 hours of birth. They usually pass meconium, which is the first poo, and it's really important that they get this passed. It's usually very dark, hard poo, and if they don't pass it, they can get very uncomfortable, get impacted, and start being a bit colicky. So important to look out for that as well. Then there's the navel. Usually the umbilical cord will break once the mare starts getting up after the foaling. But it is an entrance into the foal, and it's an entrance port for a lot of bacteria. So it's important to keep it clean and dry. So I always recommend dipping it in a dilute chlorhexidine and spirit alcohol dip. It needs to be very weak pink color, and dip that in it to keep it nice and clean. When it comes to the mare, then she has the placenta that she needs to have passed, and that usually passes within 3 hours. Then I always recommend having a vet come and check the mare and the foal the day after foaling, usually at 12 to 24 hours after the foaling, just to check that both mom and baby are okay. And I strongly recommend having a blood sample taken for IgG, which measures that the foal has gotten enough colostrum, which means that it's better protected, it has antibodies, and it overall strengthens its immune system and make it a lot less likely that the foal is going to get sick. So what if something should happen? When is the time to call the vet? During foaling itself, the main kind of emergencies it could be is one, either that we have a red bag delivery. And as you can see on the right, it's a picture of a red bag delivery. Luckily, they don't happen very often, but it's very important that you know what to do. So a red bag delivery is an absolute true emergency. So instead of having a white bag presented, like I explained previously, you'll have a red bag with a kind of like star shape on it presented instead. So this means that the placenta hasn't broken and that the foal can't get any oxygen. So if you see this, the most important thing is to break that bag immediately. You can usually just do it with your hands, rip it apart. You can use a blunt object as well if you do have it. Just be careful because you do have a foal on the other side. But absolutely important that you get that open straight away. Open it first, then call your vet, because the foals, depending on how long it's been going on, the foal can be very compromised, not having oxygen. So regardless of if you get it open straight away or not, I definitely recommend calling your vet so they can come and assist the foal in case that there should be any issues. The next thing is if the foaling is not going smoothly. So usually from the time that you start seeing legs to the foal is out should not take more than maximum 30 minutes. If at some point it seems like the foal isn't coming out or something is wrong, call your vet, because time is definitely essential in these kind of cases. If you do have a foaling that does go normal, but you get a newborn foal out that seems very dull, not really interested in attempting to stand, doesn't have a suckle reflex, isn't trying to drink from the mare within the first few hours of life, again, extremely important that you call your vet. It's not really something that can wait foals are very fragile, and especially newborn foals, it doesn't take a lot before it can go south. So by all means, rather ring your vet a bit too soon in cases that. Other than that, as I mentioned before, meconium can sometimes make them a little bit colicky, and if they have continuous straining, it could be because they have an impaction of the meconium, and in that case, they need to be seen as by a vet as well. When it comes to the mare, some mares will show mild signs of colic after foaling, but if in any case she starts to be continuously colicking or severely colicking, it's very important to get someone up straight away. The other thing is the placenta. As I mentioned before, it needs to be passed within the first 3 hours after foaling. In case it doesn't pass, it is an emergency, and it does require that to come out, because the placenta being retained can cause life-threatening infection to the mare. So if it hasn't been passed within 3 hours, it needs a vet seeing. When it comes to a little bit later in life and the older foal, there's a few things that might not cause concern in an adult horse that will cause concern in a foal, and it's just important to be aware of those things. So firstly, if the foal is off suck, if the foal is not drinking milk, you will be able to see it on the mare. I have a picture there on the right. It's a bit extreme, but that's a foal that hasn't been drinking for a very long time, and as you can see, the mare's very filled and starting to expel milk herself. Sometimes you will just see it as the mare's udder's getting really hard and she's getting uncomfortable. Foals that stop drinking can get dehydrated very quickly, so it's important to stay on top of it and do something about it before it's too late. As I said before, foals are extremely fragile and it can go bad really quickly, so better be on it. Next thing is diarrhea. Foals are prone to getting diarrhea. Usually when it's bad, they go off suck as well. So any kind of diarrhea in the foal is important to talk to your vet about. Foals do get what we call foal heat diarrhea at about day 7 to 10, which usually just happens because there's changes in the bacterial flora, gives them a bit of diarrhea. And at that point, they're usually happy, perky, and drinking, and it can last up to a week. If it lasts any longer, or if the foal doesn't stop drinking from the mare, again, it is an emergency and it needs to be seen by a vet immediately. Then something like lameness, and this is especially in foals that maybe are about a few weeks or a month, but it can be later as well. In case that your foal is lame or has a little bit of swelling, don't ever think that it's because it just twisted something in the field or did something silly. Lameness in foals needs to be taken extremely seriously. They are unfortunately prone to getting infections, usually from the navel, which can spread in the bloodstream and go and manifest in the joint. So any kind of lameness in foals needs seeing straight away. And then, as I mentioned a few times already, the navel is very important. It needs to be clean, it needs to be dry. We can't have any kind of exudate like we have from the two pictures in the middle. Any kind of swelling always warrant for an exam as well. So if there's anything that's not looking right, get someone to check it. And then, as with any other horse, any kind of dull behavior or not feeling right, always get someone to look at them. You can always ring your vet for advice, but it's just extremely important to be vigilant with foals because, as I said before, and it bears saying again, things can go bad really quickly. So always better to ring a bit too soon than too late. And then just lastly, a few things to have in mind in case that you do have an emergency. It's not often it happens, but you just need to be prepared on what you can do in case there is something. Again, the first thing is to call your vet, of course, but just do have in mind, in case it's needed and either your mare or your foal is very sick, do you have the transport to take it into hospital? do you have the means and the facilities to do any kind of aftercare in case that it's needed? And then, though we all want to do the very best for our animals, do you have the money for an intensive treatment of either your mare and foal? And that's it. I hope you don't look like me in this picture by now, but I thank you very much for your attention, and I'm ready to take whatever questions.
Thank you for that, Lena. A very whistle-stop tour of everything foaling related. We did have a few questions come in. One of them was asking about how long is it reasonable to keep an in-foal mare in work. Now, you did touch on that. We're saying, really up until that 3rd trimester, but what would you say counts as vigorous exercise? Is it all right to jump a mare in her 2nd trimester?
Yeah, I think you can do a fair amount of exercise. I would say in the 2nd trimester, you can almost treat her like normal. I do say that I think a lot of vigorous exercise, like taking them to the gallops or doing eventing, might be a bit on the much side. But low grade jumping, schooling, light hacking is completely fine, and they can definitely have a canter. It's not a problem. But if we go to the point where we're going out galloping every day, it might be a bit on the much side.
And the next question was, is it typical for a pregnant mare to show periodic, mild, slightly colicky symptoms of discomfort? And if they are showing that, should you do anything other than walking?
I think the short answer to that is no. Your mare really shouldn't be showing any signs of discomfort during the pregnancy. It does happen occasionally, and I think it's the same with pregnant women. I haven't tried it, but I've heard, I do definitely think you can get quite uncomfortable, and it does happen with the mares. However, if it's something that occurs a lot, and we're talking like several times during the pregnancy to the point where you think, this is odd, I would consider getting that checked out, having the mare checked, her overall health, having the baby and the pregnancy checked with an ultrasound scan, just to see that everything is all right, because it's not quite right. Some mares, of course, are a little bit more sensitive and respond a bit more to the foal's movements than other mares, but I think in short, no, it's not normal, and it should be investigated.
You touched in your first slide about the correct age window for a mare being sort of between 4 and 14. Is there a perfect time within that time frame, or is that whole window really a safe window for trying to get a mare in foal?
Yeah, I do think younger is always better for maiden mare. I would say that even though I say the best time to breed them is between 4 and 14, that would be for the first time. For a mare that's had several foals, they can breed very easily well into the late teens, so that's not an issue. I think younger mares are better, so the younger, at least when they're over 4 and they are fully matured, the younger is easiest. They carry the pregnancy better. They're usually better fertility. But up until the early teens, we do have very good conception rates, and they carry their pregnancy quite well.
And going back to the bit about mares being seasonal breeders, is there a point where it's too late in the year to put them in foal?
Yeah, well, there's always a few things that you need to think about there. So you have to keep in mind that the mare's pregnant for 11 months. So from the time that you get her pregnant, then usually a month before that, the next year is where she's going to foal. And you want to keep, we're unfortunately in a country where the weather isn't always the nicest, and that's always nice to have a foal that's going to be able to get out, and it's not too cold and too wet and too rainy. So I do think if we're starting to get into August, September, we are getting quite late into the season, and a mare, for example, in late August will foal in late July. and the foal is not going to be very old once we start having colder temperatures and nasty weather. So I do recommend that when we get about August, we need to consider whether or not it's going to be the last cycle we're going to try on.
And I suppose then if you're planning for 3 cycles at roughly a month apart, you probably want to start planning for at least May or June to then get your 3 cycles in before it gets too late.
I think so. I think it's always a good idea if you do plan to have a foal to get them checked the first time at about April time, just to make sure that the cycling and everything is looking all right, and then late April and May time, then start going for it.
And talking about the logistics of foaling a mare down, we were talking about how big does the stable actually need to be?
Yes, so it of course depends on the size of your mare. If you have a very small mare, you don't need as big of a stable as you do if you have an Irish draft. So, but I'd say as a rule of thumb, you need to have a stable that's big enough for the mare to lie completely flat down and still have quite a bit of space around her, so that when she foals, there's plenty of space for a foal coming out of her, and once the foal is out, for the foal to run around and have enough space and not getting squashed by the mare.
And when do you start monitoring a mare that's due to foal? Do you wait and we were talking about that, keeping a really close eye on them as they get closer to the time they're due to foal?
So you do have an approximate due date. So again, I said a mare is usually pregnant for 11 months. This is a very rough guideline, and the mare usually does not care that she has a due date, and some mares can go all the way up to 12 months before they foal. So a good idea maybe asking the previous breeder what her normal gestation length is, because that would usually be the same every year. And then what you need to keep an eye on is mainly her back. So the closer we get towards foaling, then the back will really start filling up. And I would say when we get to the point where she has quite a large back, when it's starting to fill all the way down into the teats themselves, and start getting a little bit more slack behind under the tail, that would be the time that I start checking them at night. And then waxing is usually a fairly good sign that your mare is close. It is very variable for mares. Some mares will only wax the last few hours before foaling, where some will days. So unfortunately, there's not a golden rule, but that's always something to kind of keep an eye on. And as soon as she does wax, I would keep a very close eye on her.
Hey, and we had a question just come in there saying, does it matter about the size difference between a mare and a stallion? So would a 15-hand mare be too small for a 16-2 stallion?
No. The mare it's quite handily done, that the foal will adapt to the size of the mare. So I have even used a small World Section A on a Clydesdale mare, and I think we got a foal out that's probably the size of the stallion itself. So,
I have questions that are probably not suitable for this webinar about the technicalities of that. Presume that was AI.
That was AI. No, so the foal accommodates to the size of the mare. So even if you use a bigger stallion on a smaller mare, there shouldn't be a problem. And yeah, the foal will adapt to the size of the uterus.
If the mare's running a lot of milk before she foals, is that a reason to call the vet?
Yeah, I definitely think it's good if your mare starts running milk early up to foaling, or if she starts backing up way before she's due. That could be a sign that there's something going wrong. So I'll definitely call your vet and at least have a chat and say, this is what's happening. My mare is either backing up too soon or is running a lot of milk. One of the issues with running a lot of milk can be that the quality of the colostrum isn't very good. So it's good, in case that happens, to have a plan about possibly having some supplement colostrum, or having someone check them and see, is there anything wrong for her to be running milk early.
And is there a difference between fresh and chilled semen?
Yeah, so in this talk, I've only mentioned chilled and frozen semen. So we do have fresh as well. So fresh semen is when you have semen that's collected directly from the stallion without any kind of preparation. Is going straight in and being inseminated, inseminating the mare. Whereas when you have chilled semen, then it's collected from the stallion, then it's usually taken into a lab, being looked at and mixed with a semen extender, so it lives a little bit longer and can tolerate being cooled down for the purpose of shipping. And this is when you have stallions that are a bit further away. And then again, the last is frozen. So that involves having semen frozen down in little straws. But that means that it needs to be kept in a big tank of liquid nitrogen. But then it keeps for years. And it's a very good way of us keeping semen that's available in all times. And we can keep for years and years, even stallions that have deceased.
Thanks. I think that's us getting towards the end of our question list. And unless anyone has any more that they want to send through, or take themselves off mute and video at this point and ask the questions.
And even if someone remembers that they have questions a few days from now, like, they're always welcome to ring into the practice. I'm always here and willing to discuss anything.
Great. I think we'll wind it up there and say thank you all very much for tuning in and giving up your evening. Thank you, Lena. It was a really good talk.